It's been really exciting to be able to be a part of this conversation and have so many great perspectives represented. I'm going to introduce our last panel of the day on designing and delivering inclusive services, so that you all have an opportunity to hear from perspectives outside of City Hall, of folks who work with the immigrant community closely, but in capacities and in fields and disciplines sort of independent of the core services of city government. But I'm going to start by introducing Julie Dahlstrom. Julie is a faculty member here in our BU School of Law, where she oversees the Human Trafficking Clinic. Outside of BU, Julie serves as a senior staff attorney at Casa Myrna Vazquez here in Boston, where she represents survivors of commercial sexual exploitation. We're really pleased to have Julie join us today. I will mention that Tony King, who is supposed to join us, he's the headmaster of Newcomers Academy in the International School, unfortunately was not able to join us due to an emergency at the school. We will just hope for the best, whatever the circumstances may be, but unfortunately he's not able to join us. But I'm going to turn it over to Julie to do the rest of the introductions. Thank you.
Thank you, Catherine. And I just want to first take a moment to thank the BU Initiative on Cities. It's just wonderful to see such a representative, imaginative group here today to really engage about inclusion. And I'm excited. There's been so much mention of nonprofit and other types of collaborations outside of City Hall today, that we have a fantastic panel with highly talented individuals who've been really successful at building pockets of inclusion outside of City Hall, but often in collaboration with City Hall. And as you all know, this is not without challenges. Unfortunately, while immigrant exclusion can happen so easily with a word or a policy, inclusion, as everyone in this room has experience with, can be a very complex long-term project that requires planning, creativity, perseverance, and sometimes a little bit of luck. So, and this is especially true now when inclusion involves, at the very base level, I think we'd all agree, equal access to basic services like healthcare, legal services, education. And while this seems very straightforward, too often in these communities there is not readily, these services aren't readily accessible or available. And how do we approach this when we need not only that, but additional components like bicultural staff, interpreters, or outside expertise? So the panelists today have been very successful at doing just that. They've begun to struggle with these issues in a very concrete, complex way, and created vibrant pockets of inclusion that we hope will expand beyond our cities and really nationally. So with that, I'd like to introduce our two panelists who are going to speak for about 10 minutes to share their thoughts, and then we're going to have the opportunity to ask them some questions. So Dr. Crosby, who you've heard about today throughout the panels, is an associate professor of medicine and public health at the Boston University Schools of Medicine, health law, bioethics, and human rights. She's also an attending physician at the Boston Medical Center's Immigrant and Refugee Health Program. And John Szabo is the city librarian of the Los Angeles Public Library. In 2015, the library received the highest national honor for library service, the National Medal for Museum and Library Service. So I'd like to turn it over to Dr. Crosby to make a couple of introductory remarks.
Thank you. So it's really an honor to be here today. This has been a fabulous conference, so many insights, so many collaborators. As Julie said, I'm a physician. I've been practicing immigrant and refugee health at Boston Medical Center, formerly Boston City Hospital for you old-timers, for about 20 years. And just personally, my 5 children are also immigrants, so I certainly have some personal investment in this issue. My personal area of interest is on immigrants who come as refugees and asylum seekers. And, you know, as we know, we are in the largest refugee crisis ever on history now. We're seeing highly traumatized refugees coming into our communities all over the country. And, you know, one of the huge issues we deal with is how do we get communities to deal with trauma that our newly arrived refugees have experienced, and access to mental health care. And that is a challenge around Boston with limited resources. And I think the need for more training around refugee trauma and how we confront it and treat it. I'm also happy to be here. I think any conversation about inclusion in communities has to include the health system and health care. We're often first line, on the ground in the weeds when our communities come to us with issues. And as we've talked about over the morning, particular challenges around language, culture, trauma, and other things, they will often come to the doctor and dealing with issues of domestic violence, of fear of law enforcement, and when a crime has occurred, with housing issues, with discrimination issues, all these social determinants of health that we're ill-equipped to deal with, and we need to reach out to who our community partners are to help us address these. And we've talked about the importance of English language classes throughout the day, and I just can't stress what an important determinant of health English language classes are, and especially when people come to this country, they're newly arrived. We really want to jumpstart them to success, to be successful contributors and members of our community. It's a struggle with language classes. When they interfere, a person may get a job that interferes with the language class, and they have to pay the rent, so they don't go to English class. And this certainly is a determinant of health and leads to bad health outcomes, not to speak of problems with fully integrating into the community and becoming successful. We haven't really talked about a lot of solutions to that. I know just in the last few months, I had a particularly vulnerable refugee family from Afghanistan, highly traumatized, who just could not get to English classes anywhere. And I recruited a Northeastern professor of English and literature who has volunteered her time to come to the hospital where they feel safe and actually deliver English classes one-on-one with this family. And Boston and many cities have universities and teachers and schools. I think there probably is a rich resource within those that we could tap into and utilize. Teaching English is as beneficial for the teacher as it actually is for the family. So it's a nice way to really help integrate our newly arrived families into the community. I see a need for training of health professionals to be culturally aware and competent and understanding and have more openness to different values and views on healthcare. Really am interested in recruiting more of our immigrants into the healthcare community. I want to see physicians working in my hospital who represent all the ethnic communities in Boston. And we certainly do need more funding for case managers and community health workers in some of our more vulnerable communities. So I would probably like to stop there and then when we're finished, open up for discussion and answer questions.
And as we go to John, I'll just mention we were just speaking before this panel about all of the many intersections that I think we hadn't thought about in terms of libraries and their role with health outcomes as well as being safe spaces. So I would love for you to give us an introduction to your work.
Great. Thank you so much. And many thanks to Boston University and the Initiative on Cities. Always am thrilled to be able to speak about immigrant inclusion, immigrant integration, often to library audiences. I love to preach about this work and how important it is to my library colleagues, but I also really love sharing it and being with people that care about this issue and to share why I think public libraries are such incredibly powerful partners in this space. Public libraries embrace this work. There is a history of work in the area of citizenship and immigrant integration in the American tradition of public libraries going back decades and decades. Public libraries are about access. We're about books on shelves, of course, but we're fundamentally really about access, empowerment, opportunity, equity, lifelong learning. And our work in this space in Los Angeles is very much, obviously it's an important issue in the city of Los Angeles, but it's more broadly about how we can leverage these values of the public library, the presence of the public library in the neighborhoods of the city to make a difference in some of the biggest issues our communities face, which includes health disparities as well as issues around immigration and immigrant inclusion. The public library is a trusted, valued institution, and we are on the front lines. We are in immigrant communities, and we're well used by people across the city, and every day our arms are open wide. And we often have relationships with immigrant communities, which also makes us a great partner. A little bit about the Los Angeles Public Library. We serve the largest population of any public library in the country. It's because New York has Queens, Brooklyn, and New York Public, so we have the largest population. So we serve just over 4 million people in the city of LA. I'm a department head within the city of Los Angeles. I work at the pleasure of the Mayor Eric Garcetti, Mayor of LA, and where we do have an Office of Immigrant Affairs and work with them very, very closely in planning initiatives and doing this work. We do that through our central library, 72 branch libraries across the city, very much a gateway city in LA. About 39% of our population is born outside of the United States. 77% of them have arrived since 1980, 20% in the last decade. So we definitely are an immigrant city. In 2012, we became the first public library in the nation to partner with the United States Citizenship and Immigration Service to establish Citizenship Corners, we called them at the time, and we're rethinking that name now. Not in 5 of our libraries, not in 10 of our libraries, but in every single one of them. And it was materials from USCIS, flashcards to help people take the test, information about the N-400 form. Basically, the basic information you need to take that first step on the path to citizenship. And we branded it as your path to citizenship begins at the Los Angeles Public Library. Part of that, not only putting materials on a shelf in a corner of the library, we also trained staff throughout all of our libraries on how to answer basic questions about the naturalization process. And we also partnered with a number of nonprofits in the community to come into our libraries and have citizenship classes and also have major events that were all-day events where we brought in attorneys speaking a variety of different languages to sort of walk people and through the N-400 form process. And that program, when it started in 2012, was very much about the 750,000 people in LA who are legally eligible to become U.S. citizens, legal permanent residents. And it was wildly successful. It is a national model. I'm delighted to have so many people have mentioned the work of Citizenship Corners, USCIS, and libraries today. Carl Dean is a wonderful person to give shout-outs about it. I appreciate that. But it has evolved into so much more than that now. It is not just about citizenship. It is about, they are immigrant integration corners, and they are new American spaces. And so we are in the process now of rebranding these spaces as New Americans centers. We are also looking to get more targeted and strategic at doing this work. So we are going to establish 6 sort of super centers within libraries where we can really have an impact. We're becoming BIA, Bureau of Immigrant Appeals, accredited. We're going to bring in BIA certified individuals to actually do what we have been doing at these events, or just when a nonprofit comes into the library, but doing it every day of the week that the library is open. And our centers are also providing information about the law in California that now allows undocumented residents to have driver's licenses, providing that information. Also financial literacy training and other services. And this is so important to do, not just because it's the right thing to do and because it addresses the big issue in our community, but as I like to tell my fellow library colleagues around the country, it's strategically important for the library to do this because we're reaching broader audiences. We're connecting these individuals who come in for flashcards to take the test or may come in for a citizenship workshop. They're going to learn about our literacy services. They're going to learn about Spanish language story time. They're going to learn that we have materials in Armenian and Farsi and other languages. So it's good for the long-term health of the library as well. And we also are able to connect people to the health programming that we do, financial literacy programming as well. And Carl Dean mentioned earlier that there's great opportunity not only in big cities for doing this work, but in smaller communities as well. And it can be a tougher sell. There are all sorts of challenges in smaller communities. But before coming to LA, I was director of libraries in Atlanta and would frequently meet with and talk to my fellow library directors in small towns across Georgia. And let me tell you, that it's necessary to do this work in libraries in those communities as well. And so that's very important. And I think libraries are fertile ground for beginning that conversation in a local community. And it's not about the politics. In our space, it's not about the politics of immigration reform. People will come. People are going to come to the library because of who we are and because of our approach and attitude to ask us the questions, to ask us for assistance. And when they come, we want to be prepared and ready. So it is incredibly important work. We love working in this space, and our staff have been really wonderful in terms of owning it, not just being a physical space where these events and these classes and this activity and this information and this material is and happens, but that really owning it as a service of the public library.
Wonderful. I know we've heard mentioned today quite a lot. One of the profound needs now within the immigrant community is access to legal services and low cost or free legal services. And I know both of you mentioned, and I know that you work to really connect refugees or undocumented immigrants with legal services, although it may be challenging when there aren't sufficient services. So I'm just curious if either of you or both of you could talk about how you have made those connections, and also if you're building capacity internally, how you have done that.
So, yeah, no, that's a great question. And so often my immigrant patients will come to me and ask for legal assistance. So over the years, we have built up very strong collaborations with organizations around Boston. For example, one of, I think, the strongest organizations is the PAIR Project, Political Asylum and Immigration Representation Project.
We all just say PAIR, so it's
PAIR. And that is a pro bono network of immigration lawyers who will take on cases, and they've been fabulous. So if they have a client that comes to them that needs medical care, they will send the client to us. We have somebody who needs legal assistance, we will send the client to them. So that's been an amazing collaboration. There are other places in Boston, Greater Boston Legal Services that we work with, Classic, which is another NGO organization. And the resources for legal services, it just doesn't meet the demand, but we try very hard to do our best to connect people. And there are a number of private attorneys that we have developed relationships with that will do a sliding scale, based on a person's income. But it's a challenge, but certainly building those collaborations and networks has been really important to us.
It sounds like you have some creative ideas for us.
Yes, well, we're really excited about becoming BIA certified and having BIA staff on board doing this work regularly. Up to this point, we've partnered with, and will continue to, of course, several wonderful nonprofits in the community. NALEO, National Association of Latino Elected Officials, does incredible work. Asian Americans Advancing Justice, Casa and Chirla. I mean, there are about 13 different nonprofits that do that work and provide the legal assistance within our libraries. But a real challenge has been capacity of those organizations to be able to continue doing that work. Because here in the library, we're saying, yeah, come on, let's do it. Can you do it next Saturday? Can you do it next month? Let's schedule an. And they have funding issues, and as you all in this room know, there is enormous demand out there. So we're fighting for their time, their energy. They do love partnering with us, but they have many obligations themselves. So it's a challenge, and often those organizations are competing for funding between each other, which is challenging as well. So we're working to bring in funding ourselves through the library for this work, and also putting some of our own funding and our own budget toward it, because we are so committed to it.
It's so important. That's fantastic. I know that you mentioned in terms of the importance of words and naming, and how you've moved away from using this term Citizenship Corner to something that's more kind of inclusive of different populations. And I'm just curious if you could both talk a little bit about whether your approaches differ in terms of how you approach undocumented communities who may have certain needs for legal services that differ from documented people like refugees, or different health needs, and whether your approaches have differed over time.
Well, our move away from Citizenship Corners is, one, it's not just citizenship anymore, and it's not a corner. I don't know. To be honest, I never did. No offense to USCIS out there, but corner made it seem to minimize it and make it small and over there and all of that. And I want it to be in the middle of the room, and so it's really the fact that it's about immigrant inclusion, integration, and all of that. And we absolutely do not differentiate, although the needs are different. We don't differentiate undocumented or documented. But we do, in our communications, want to let the undocumented population know library services are free. We're here for you just as much as we are when the mayor of LA walks in the front door. And so trying to make certain through ethnic media and other channels to make certain people know that the library is available for everybody, and a library card is a very easy thing to get.
We at Boston Medical Center are just really inclusive of anybody. So, of course, legal status matters in terms of what resources that we will refer the person to. Do they need an asylum lawyer? Do they need some other type of legal assistance? And also for getting health insurance, and that's one thing I forgot to mention. And I feel very fortunate that we don't turn anybody away for care, regardless of their status, regardless of whether or not they have money. We will find a way to get them health insurance. But again, it's going to depend on whether they're eligible for Mass Health, for the free care safety net, or some other kind of insurance. But in terms of the care they receive, the status doesn't matter.
And we're fortunate in Massachusetts to have a fairly humanitarian approach.
We have a very humanitarian approach to health care in Massachusetts, and I feel very fortunate for that.
So I know that we could all not do this without important allies outside of your offices, and I'm just curious, we've talked a lot about partnerships with the cities, but if you could speak to just important allies, external allies, and how they support the work that you're doing.
Well, certainly all of our partners, when they're able to talk about the partnership with the library and the work of our libraries, we participate in something called the Immigrant Integration Task Force in LA, which is convened by the California Community Foundation. Mayor's Office of Immigrant Affairs is an incredible cheerleader for the work that we do. Our city council, very much an immigrant supportive, friendly city council. LA is a great place in that regard in terms of really getting and understanding the need. And also local corporate partners as well. And our library foundation as well, helping pivot them in a way of not only funding the traditional kinds of things that they funded with cultural programming and early childhood literacy and tutoring and things like that, but to actually fund some of this work in the area of citizenship and immigrant integration as well.
That's exciting.
So we've had great allies within the city of Boston. Project Citizenship, we send all of our patients who are eligible for citizenship to them to get assistance with the exam, passing the exam. In fact, somebody brought us over the flashcards. We have them in our clinic. We have volunteers who will actually go over them with patients. And we also work very closely with the Department of Public Health, Refugee resettlement program here in Massachusetts. So, I mean, all of these connections and collaborations are critically important to us.
I agree. And so this is a question of maybe more for John, although feel free to jump in, which is, as we are moving away from perhaps books and to more electronic media, and everyone, or many people are moving online, how does that affect your approach to this particular issue and also raising awareness about the services that the library offers?
Sure. Well, our virtual space is every bit as important as our physical space. You know, it's not just it's a service delivery mechanism for us. You know, last year we circulated almost 5 million pieces of e-content. So we're purchasing e-content, making it available, e-books, streaming videos, film, audiobooks, e-comics, newspapers, magazines, all of that. And increasingly accessing and purchasing access to that content more in other languages, using the net for communication channels to immigrant populations, looking at developing an app specifically around our work in this immigration space, and using it as a promotion tool. But also it's caused us to rethink how we think about our physical space and how we might use it for civic engagement, use our meeting spaces, our physical spaces. I think books are still going to occupy a significant amount of square footage in libraries, but much as academic libraries have created information commons, our need for the square footage is still there, but it's people space. Mm-hmm. It's a place to have a program around a health topic, so as we look to address health disparities, a citizenship class, and also help people make use of new technologies and learn how to access our virtual resources within our physical space.
And I would imagine that's increasingly important as well, as we see real disparities in terms of who can access the internet. So people may not be able to access the web page, but they can come in and still access the physical space.
Exactly.
I have a question for you. Do you
That's great.
do you partner with any healthcare organizations about health literacy? That's a huge challenge for us, and we in the hospitals just don't have the capacity to be or the funding to develop health literacy materials in so many, languages, culture specific. And it would be what a great resource to be able to partner with a library to help deliver some of those.
Yes, well, health literacy is a social determinant of health, and we in our work around Affordable Care Act and Covered California and working with nonprofits and Covered California to help people enroll in ACA and Covered California, we found that working with some of the same partners that we launched the citizenship program with, Asian Americans Advancing Justice is one that comes to mind, NALEO and others, also work in the space of health. And so one of the things we worked with them on was developing sort of a health insurance 101 curriculum, because we found so many people being new to the health insurance space, didn't even understand what that was. So we worked with those nonprofit partners on that as well. And we work with a number of public health agencies and nonprofits to not only do health literacy and programs around specific health disparities within specific geographies of the city. So it might be asthma in one neighborhood, cardiovascular disease in another, but also on some delivery of services. So in about 8 branch libraries in the fall, we have a nonprofit partner come in and give free flu shots. Over the summer, recognizing nutrition's role with Summer Slide, we served 12,000 meals, free meals to kids, nutrition and also addressing health. So, yeah, we do a lot in that space.
So I want to allow enough time for questions from the audience. So I'm going to go ahead and ask if there are questions. Please feel free to raise your hand. Yes.
When talking about your libraries becoming certified, can you tell us a little more exactly how you're going to do that? Are you going to have lawyers like on staff or to sit in there? How is that going to work? Or have you figured all that out yet?
Well, we're almost across the finish line. So there are people in this room that could probably explain BIA certification much better than I, but it's a two-step process. One is certifying the institution and organization, and the other is staff. And we're envisioning individuals bringing people on who are already BIA certified into library staff on a contract basis, rather than have our existing, although we do have 6 bilingual outreach librarians whose sole role is outreach. They did go through the BIA certification process just so that they could answer questions and understand that. But generally speaking, for labor reasons, we're not going to have 75 of our librarians, for example, become BIA certified. So, but we're envisioning that they're going to be more paralegal types rather than attorneys. But when we partner with those various nonprofits I mentioned, it's often attorneys who are coming in and actually providing assistance on a single day. But in these 6 libraries where we're sort of going to have these super centers, it's going to be BIA certified staff.
And I just wanted to add a follow-up question. Do you envision that they would focus exclusively on citizenship or respond to other
I think a
requests?
variety
That's great.
of immigration issues. Yeah. Yeah.
There was another question in the back.
Thank you, Dr. Crosby, taking care of patients, immigrants' patients, especially those are undocumented. But what do you see the role of the health centers that are located right in the communities in terms of health education and also English languages for immigrants that do not speak the language?
I love the health centers in the communities, and Boston Medical Center has partnered with a number of health centers. I think that English language should be part of health centers and health education, and I think there's a lot of opportunity that we need to really expand those services as part of the health centers, as part of the medical home for the communities. So I do see that as a role for the health centers.
Many libraries will also do that as well, whether it's English language, just informal conversation classes, or more formal ESL.
I think, yes.
You've already started alluding to, I think, the answer to this, but in both of your spheres, I think you see a much larger picture of the individual who comes to see you rather than kind of the primary reason why they've come to see you. And so I'm wondering if you are drawn to be an advocate in other areas of the life of the immigrant or refugee that comes through your door, about bigger, maybe infrastructure issues or municipal challenges, things that might kind of require the relationship with city government, or is there a relationship there for issues? Transit is one that comes up really big in Denver, public transportation systems to get to the clinic, to get to the libraries, things like that. Do you take part in those conversations?
I will answer yes, and I probably spend half of my time not doing actual medical things, but helping to bridge what these challenges are. And I'm already very excited to make an appointment to go see the mayor's office and talk about these things. Transportation is a huge problem for our patients. And so, yes, I work very closely with the Department of Transportation, getting T passes, figuring out who needs the ride, how, and so yes, also I'm very familiar with Boston Housing, another equally important social determinant of health, and they all know me when I call them to advocate for my patients. So yes, transportation, housing, English classes. And the other thing I wanted to bring up, I didn't mention enough, is employment. Employment is actually another social determinant of health. And there are certainly studies that show that people that are meaningfully employed have less health and mental health problems. And so it's always a push to try to find a place for job training. For a lot of my newly arrived refugees, this has been brought up before, they come with skills from their own countries, and we're not tapping into those skills. How can we get them mentors? The journalist, the engineer, the nurse, the physician who come here, how can we get them to mentor and be folded into their professions in their new home? So yes, my sphere of work taps into all of those areas.
Well, yes, and it's another reason why the library makes sense in this space, because our staff are regularly, on a daily basis, making referrals not only to other governmental agencies, other parts of government, but other nonprofits as well. And also, I think institutions like ours and yours that are working in this area can provide wisdom and intelligence to policymakers within the city, because we're working in this area and can provide data and information and help the broader organization understand this issue because we're so involved in it.
So towards the end of my tenure in the city of Philadelphia, Jefferson Hospital came to do an interview related to a community assessment that was required by the Affordable Care Act. And they had a battery of questions, and we went and we talked about this. I am wondering, as this has evolved, what are we seeing in terms of the results of those assessments, hospital services, language access, health, outcomes in terms of health? And I'm curious because I don't know much about this, and also why only one hospital knocked on the door, the mayor's office of Immigrant and Multicultural Affairs, and not all the hospitals of the city of Philadelphia. So I'm wondering if in your role you have seen any outcomes or follow-up.
That's a great question, and I think we need to do more work on that in our city. I am personally not aware, and anybody from the city of Boston may correct me on this, of health outcomes research in specific immigrant communities. I mean, certainly there's data on, for instance, heart disease in the Vietnamese community, and small pockets of studies, but I have not seen anything citywide.
But do you know what is transpired? So these assessments are taking place, right? Because presumably the hospitals need to meet certain guidelines or certain metrics. But how are those assessments, how is the immigrant community being impacted by the results of those assessments? I guess
I don't know the answer to that in Boston.
Any other questions?
Last night, Gary Pavkovich from the city of Stuttgart used the phrase intercultural, right? He said that our goal in Stuttgart is not to build a multicultural community where there's different cultures that are islands unto themselves, but actually to build links across all of them. And so I'm curious, I guess, John, this is more of a question for you. I'm curious about the role, in our community here in Boston, just as one example, for Dia de los Muertos, there's a festival that's for the kids, right? And then there's food and there's dancing and there's performances, and it's in our local library, and it's a way to sort of, again, foster intercultural interaction and a sense of identity by exposing kids to just to different perspectives and different cultures. And I'm curious about the role that the library may play in fostering those intercultural relationships rather than just the multicultural relationships, or the supporting multiculturalism in the city.
Absolutely, and by doing this work, we're developing relationships with new communities, and that informs our cultural programming for youth, for adults, It informs, our exhibits. So absolutely, and I think there's a particular need for that in LA. LA is big, it's sprawling, it's incredibly multicultural, and there are, huge communities that can be very segregated and separate, and the library can help, I think, connect those communities and connect those neighborhoods, and neighborhoods are constantly changing. One branch library is serving both Oaxacan and Mongolian community, and how that blends in the library, how that blends in terms of cuisine is a beautiful, beautiful thing. So it absolutely is. And our expectation of our children's librarians, teen librarians, branch managers across the city is that they will be engaged outside of the library walls with cultural organizations, neighborhood councils, community, to make certain that the branch is not a cookie-cutter branch across the city, but is one that serves that community and weaves that cultural programming into everything that we do.
Okay. One of the questions I want to ask you all is the benefits of hospitals or of libraries is that you don't necessarily have elections, that there is some continuity, we hope, among staffing. So I would be curious your thoughts, number one, about how politics, if at all, shape the work that you're doing, and also if they don't, if continuity is a positive, how we can leverage that, and as we're working with cities.
One way, and we're incredibly well supported, and these things I'm talking about are not sort of political hot potatoes at all in LA. One of our challenges, though, is how do we say no? And you can tell from everything I've said, we're pretty good at saying yes. Financial literacy, libraries, health, libraries, and we love it. And it's absolutely wonderful for the strategic mission of the library, and also for people's understanding and perception of the library as the incredibly dynamic institution that it is. And we are the face of local government. We're the institution that touches people, I think, more than any other area of local government, and usually touching our residents and connecting with them in a positive way. But how do we have a sort of strategic framework to connect all of this to a core mission of the library? And it is challenging because we're, I think, doing a very good job in all of these areas. We get asked to, the library is the face, so let's use the library as a delivery channel for these 18 different things. And I want to make certain that we are not just air-conditioned and heated square footage where cool stuff happens. That we are fundamentally about access, empowerment, opportunity, that we stay core. We may not be doing it just through happenstance of pulling a book off the shelf anymore. We're doing it in a more active way. So that's a bit of a challenge. A nice challenge to have.
No, that was great. I think we, in the hospital arena, certainly we provide a healing environment for our patients that is stable no matter what is happening, with the politics outside. So our patients always feel safe to come to us. And, it is a challenge throughout, with funding ebbing and flowing, and through, different political climates. And, certainly I'm just going to put it out there. It's been a hard year for immigrants and for our refugee patients in Boston. Even starting back in the fall with the Paris attacks, the Brussels attack, our patients, some of our immigrant populations have felt a backlash in the communities. And, anti-Muslim backlash was felt by many of our patients. And, they have a safe space in the hospital. And, certainly I think one of the ideas that I've gotten from this conference is how do we just start the conversation with refugees, immigrants, and, our native-born populations, really talking about some of these deep, hard issues. But we want to keep the hospital a safe, healing environment for that.
So we'll take if there are any further questions.
I just have one other, and I'm curious in your respective duties. You touched on this of saying when do we say no? We would have, in my old life, we would have called it scope creep, right? We keep saying yes, we keep saying yes, and we keep saying yes, and suddenly we're responsible for everything. But I think it also gives you both do so much, and you do so much beyond what would be a prototypical job description, that I'm curious where you see a great unmet need. And that could be a what, it could be a who, either because the resources aren't there, it's sort of beyond your purview, you just haven't been able to help. But if you had sort of all the resources in the world, or you could point someone in the direction of an unmet need in a community, particularly people who work serving immigrants in their cities, what have you seen in your respective communities where you say, no one's there, and we can't be there, but no one's there?
I would just say off the top of my head, I would really like to see more community health workers and case managers for newly arrived populations, to really acclimate them and welcome them to the community and teach them about health in their own homes, which is where they really want to be. And also, we need to design English language learning classes that fit the needs of the population, and not the other way around, where they need to fit into our pigeonholed idea of what English classes should be. So those would be the two main things I probably would ask for if I had a wish list on the things I see on a daily basis.
I wish there were immigration concierges in every neighborhood that could help help people navigate the incredibly complex landscape of where to get services. I'm sure that's a need in a lot of different areas, but imagining yourself as an immigrant trying to navigate where to go is really, really, really challenging.
So with that, I just want to thank Dr. Crosby and John, and also to invite you all to continue to ask these questions in the session that will follow. Thank you.
Thank you. Thank you.